Hi there, this is Dr. Lawrence King, one of the chiropractors from Corrective Chiropractic in Aylesbury and Milton Keynes. With us all working from home a little bit more these days, we're going to do a number of short videos that will look at some of the conditions of the spine as well as some tips that can help you prevent future issues. So today we're going to look at something called anterior head syndrome, and that looks at the relationship of the neck from the shoulder up to the top bone in the neck here. So if we look at the neck from the side, what we should ideally see is we should see a nice curve in the neck, which when we measure that on our x-rays at the clinic should be around 40 degrees. We also look at the alignment from the midpoint in the shoulder to the top of the neck, and the top bone in the neck sits just below your earlobe. And these 2 points should line up equally. When we have this curvature and when we have this alignment, each of the joints, the discs, the ligaments in the neck can do an equal share of the load. The muscles that surround the neck operate under normal tension and function under normal tension. Now what will happen, often down to car accidents or postures with reading, mobile phones, time at a laptop, is that we will start to lose this curvature and we will start to lose this relationship between the shoulder and the top bone in the neck, and that's what we call anterior head syndrome. So if we look at this on the right here, we can see that that relationship has been lost and the head is sitting too far forwards in relationship to the shoulder. Now if we look at an average head weighing between 5 and 7 kilos, for ease of explanation, let's call this one 5 kilos. When the head sits directly on top of the shoulder, it will behave like 5 kilos. For every inch it moves forwards, it adds another 5 kilos of weight to the head. So to understand this relationship, it'd be very easy to take a light dumbbell or weight, even a litre bottle of water, hold it in close to the chest and feel the weight of that. As you start to move the centre of gravity and move that away from your body, you'll see that it puts more demand on the tissues, in this example of the shoulders. And those same principles can apply when we look at the relationship between the head, neck and shoulders. So as that head moves too far forwards, that puts more demand on the muscles at the back of the neck here. It puts more demand on the joints, the discs through the neck, and that can result in a number of symptoms. Okay? Common symptoms when we look at anterior head syndrome, the obvious one is neck pain. It can cause headaches, dizziness, arm pain, tightness in the muscles, shoulder pain and slipped discs. So what we'd ask you to do is look at the workstations, look at the position you use your phone in, your computer in when you're reading, and ideally try and keep the head on top of the shoulders. If you have any questions specific to your needs or any problems that relate to this video, please feel free to add comments below the post or send us a private message and we can answer your questions.